This is part one of a three-part interview we did with Rolando Mercado. Rolando is like a walking encyclopedia of Medicare knowledge. He has over 20 years of experience in the Medicare health insurance industry and is the principal broker and owner of Diversified Insurance Options for Seniors LLC, based in Blackwood, New Jersey. Rolando is licensed in New Jersey, Pennsylvania, and Delaware. Rolando focuses on education, sales, and service of Medicare supplement plans, Medicare Advantage plans, Medicare prescription plans, and hospital indemnity plans. He has been a speaker at several different senior groups, clubs, and organizations, as well as at several seminars that we have hosted. In this interview series, Rolando will explain Medicare Part A, Part B, Part C, Part D, Medicare Supplement or Medigap, Open Enrollment, Special Enrollment, Late Enrollment penalties, extra help, and more.
Rolando, how long have you been helping clients with their Medicare issues?
Altogether, at this point, I've been helping individuals with their Medicare needs for the past 21 years.
And can you tell me, do you need to have any kind of continuing education to be proficient in this field?
There are both federal requirements, trainings, and certifications, not only from the federal government, but also each and every carrier has them.
Okay, and before we get into Medicare, can you explain the difference briefly between Medicare and Medicaid?
Both programs, although they are government-sponsored programs, Medicare, which is the program that we will focus on primarily today, but that's a federal program. While Medicaid is a joint federal and state program, Medicaid is for low-income individuals, not only low income, but also limited assets.
Okay, so let's get right into the topic for today, and that is, can you explain to me what is Medicare?
Medicare is a program offered by the U.S. government that offers health insurance for U.S. citizens and for those that are here lawfully within the United States. It's basically for individuals that are age 65 and above. However, individuals under 65 can be eligible if they have certain disabilities or have been disabled for a period of 24 months.
Who runs Medicare?
Medicare is run and administered by the Centers for Medicare and Medicaid Services. However, the enrollment in Medicare is done via Social Security.
I understand that there's several parts to Medicare, so I think there's four. What are the four parts of Medicare?
Well, there's Original Medicare, which is Part A, and Part B of Medicare. Part A in general is provided by the federal government. It's available to individuals that they or their spouse worked a minimum of 40 Medicare eligible quarters. Part A of Medicare covers their inpatient hospital stay, skilled nursing facility, home health care, and hospice.
So that's Part A. What would be the next part then? Part B?
Correct. The other part is Medicare Part B. That's what on your Medicare card reflects as medical insurance. That's also provided by the federal government. However, there is a monthly premium associated with Medicare Part B, and that's based upon what your income was a few years prior to. Medicare Part B does cover your physicians. It covers your outpatient services and things like durable medical equipment.
Okay, so I think I'm getting the hang of this. If there's a Part A and a Part B, there probably is a Part C. Could you explain that one?
There's also a Part C. It's known as Medicare Advantage plans. These are offered by private companies. Now, Medicare Advantage plans is just another way for individuals to obtain their medical benefits. It combines both Part A and Part B of Medicare, and sometimes also covers Medicare Part D, which is prescription drug plans, so we'll get into that next. Medicare Advantage plans are just private companies that have a contract with the federal government. That means they have a contract approved by Medicare, and these plans must cover the medically necessary services that would be covered under Part A and Part B of Medicare.
Okay, so then tell us a little bit more about Part D.
Sure. Part D of Medicare is the Medicare prescription drug coverage. These are also offered by private companies. Medicare Part D helps to pay for outpatient prescription drugs. Medicare Part D plans are managed by private companies that have been approved by Medicare, and they help with coverage for prescription drugs in two ways: voluntary enrollment in a standalone prescription drug plan. That means it's just a prescription drug plan only, or through a Medicare Part C, which is the Medicare Advantage plan that may come with prescription coverage.
Okay, now a lot of people probably wonder, does this Medicare just magically happen? At what age do they have to sign up for it? Can you tell us a little bit about how that works?
Individuals that are currently collecting Social Security or Railroad Retirement Board benefits will automatically be enrolled in Medicare. That occurs 3 months prior to their 65th birthday or just prior to month number 25 if they're on Medicare due to disability. Individuals that are still working or not collecting Social Security or Railroad Retirement benefits would actually have to contact Social Security or Railroad Retirement for additional information as far as enrolling.
So when should people then enroll in Medicare?
Well, there are several times when you can enroll in Medicare, and it's going to depend on the individual's specific situation as to when they actually want to enroll in Medicare.
What would be the initial enrollment period then?
The initial enrollment period is the first time that the individual is actually eligible for Medicare. So let's give you an example. That period lasts for 7 months. Let's say that Joe is going to become Medicare eligible during the month of June. So his birthday is sometime between June 2nd and June 30th. His Medicare would actually begin June 1st. So he would have the months of March, April, and May to actually enroll in Medicare for an effective date of June 1st. If he does not enroll by that time frame, he still has an additional 3 months, which would be July, August, and September to enroll in Medicare.
So why is it important to enroll in this in a timely way?
The importance is due to possible penalties that may arise if someone does not enroll when they're initially eligible to enroll.
So Rolando, are there any other enrollment periods?
The next enrollment period, Phil, is the general enrollment period. That's for individuals that did not enroll in Medicare Part B when they were initially eligible. Let's give you an example. We've got this gentleman by the name of Jim. Presently, he's age 75. However, he retired at age 65, and since he was healthy, he did not enroll in Part B of Medicare at that time. He's had no other insurance for 10 years except for just Part A of Medicare. Now that his health is declining, he's decided, wow, now I need coverage for doctors, outpatient services, durable medical equipment. And so Medicare allows individuals that did not enroll when they initially were eligible to enroll during the general enrollment period, which is the time frame of January 1 to March 31st on an annual basis. However, Part B of Medicare will not begin until July 1st of that year, and the individual will be penalized for not having enrolled in Medicare Part B when they were initially eligible.
Okay, then can you talk to me, explain to me a little bit about a special enrollment period and what that is?
Special enrollment period is another enrollment period offered under Medicare. Now, most individuals do not qualify for a special enrollment period. However, there are instances where individuals may qualify for Part B of Medicare at this time without the penalty. So that would be a special enrollment period. An example of that, let's talk about my buddy Rob. Rob, when he retired, he was covered under his wife Kathy's employer plan. Now, her group plan through her employer, there was more than 20 employees, so the group plan was primary and Medicare would have been secondary, so he did not have to enroll in Part B of Medicare. Now that he wants to enroll in Part B of Medicare, he would be granted a special enrollment period thus nullifying that penalty for Part B of Medicare.
Medicare has neither reviewed nor endorsed this information. Just as a reminder, this interview is not all-encompassing. For more information, please visit Medicare.gov or call Rolando to schedule an appointment for specific advice. The information covered in this interview is only as current as the date that we recorded it, which is June 23rd, 2017.
Securities and insurance services offered through Royal Alliance Associates, Inc., member FINRA SIPC. Insurance services may also be offered through Harbour Master Diversified Financial Services, Inc. Advisory services offered through Investment Advisors Asset Management LLC, a registered investment advisor. Royal Alliance Associates, Inc. is not affiliated with either entity.